Hello, everyone. Welcome to Off the Cuff, where the headlines come to life. This is WDHT TV, and we do things a little bit differently lately. We are on Zoom with our fire chief, Chief Dave Brogan, talking to us about these changing times, about these unprecedented times, and how our frontliners are there keeping us safe, and how they have adjusted their way of doing things to ensure that the residents of Dearborn Heights are kept safe, and also talk about what we can do as residents to help them do their job expeditiously and also very, very safely. Chief Brogan, welcome to Dearborn Heights. A little bit different than our studio, but it works.
Yes, this will work. Everything's a little bit different nowadays, isn't it, Siham?
Absolutely. Very quickly, things changed, and we have to adapt. And I think people are trying to do that the best way that they can, especially sheltering in place and trying to put some kind of containment to this horrific virus that has been really plaguing our state, our country, and globally. So this really hits you hard. How are you coping, and how are you managing in regards to really coping with your own sense of reality, as well as being charged to keep the people of Dearborn Heights as safe as possible?
Right. Well, that is our number one priority, is the safety of the citizens of the city. And so we've really had to change our approach and how we go about that. A lot of times you hear people talk about social distancing and not going, working from home. And obviously that's not possible for the firefighters. Even the social distancing around the station, we can spread out to some degree, but we're in the trucks together. We're working on patients together. And so a lot of what we do is in close quarters. And so because of that, we have to take a lot of extra precautions, and it's like every week there's more and more stuff coming out on the proper steps we should be taking. So we're constantly watching it and we're evaluating and watching our call volume, because obviously the call volume is going up and up and up. And we work with HEMS. I don't know if you remember me talking about HEMS in the past. That's our medical control board. It's made up of doctors, nurses, reps from the pharmacy are there. Obviously, a lot of the fire departments and private EMS providers are there. And this HEMS board makes up all the rules for all of our response, all the pre-hospital care that takes place. So we're working under the orders of those doctors when we're working in the field. So and then the ER doctors as well. So that board has really been great as far as staying on top of things and the best practices and the way we should be doing things. And because they're working with the hospitals as well to try to keep the hospitals from getting overwhelmed. And so 99% of the time when you call us to your house, we're going to, our first answer is, let's get you to the hospital, because that's where they have the more advanced testing and things like that. But now with this COVID, this is the first time I can ever remember where they're telling us to
be selective in terms of.
Yeah. If someone just is sick with the signs of the flu, and you feel miserable when you have this, when they're talking about the minor cases, you still feel very, very sick. You have a fever of 102. You just feel miserable, and people just want to feel better. So they're calling 911 to go to the hospital to get treatment, which would seem like something that you would do. But in this instance, you're better staying at home. So you're not exposed to anyone else. You're not exposing. You're not spreading your sickness to anyone else in the hospital as well. And there's no real treatment unless you start to need that supportive care, unless you start to need oxygen or something along those lines. Those are the people that we're going to transport to the hospital. So if you have severe shortness of breath, more than just like, a mild tightness in your chest, but obviously we have to be very careful when we're telling people not to go to the hospital too. We don't want to tell someone if they're having tightness in their chest, it could be cardiac related. Obviously, we want you to go to the hospital. But if you're having a lot of the COVID symptoms that aren't severe, then the best bet is to stay home and get better at home, and isolate yourself from the rest of your family. Make sure that you have your own room, your own bathroom. Someone's putting just food outside your door, and you bring it in, and you don't want to spread this to anyone else. And that's, again, getting into the staying at home and how important that is. But as far as the fire department, that is a big change of the way we're doing things, is being more selective with who we're taking to the hospital. And then our day-to-day practices have changed quite a bit as well with the PPE and all the protective gear that we're wearing to keep ourselves safe as well.
And that's really what I wanted to talk to you about in regards to the PPE. Are we having any shortages? Do we have enough for our fire personnel? And I can't even imagine trying to make a decision whether to send someone to the hospital or not. And I know you talked a little bit about the criteria, but I mean, how are those decisions made? Is it one individual making those decisions? Is it a few, people coming around saying, okay, these are the symptoms, what should we do? Should we send them to the hospital? Can we be safe keeping them at home? I can't even imagine having to make those decisions, but what's your protocol to do them?
Right. So the protocol now, it has us looking at if your oxygen level is one of the indicators. So if your oxygen level is above 95%, then you're
Okay.
in better shape than if someone's below 95%, then you're probably going to need some more supportive care. And there are other symptoms that the paramedics are looking for as well. That's just one that's off the top of my head, but they have a list of criteria that they're going to compare you to. And then if they're not sure, they'll call the doctor and speak with the doctor about it as well. And obviously, they're taking a snapshot of where you're at that time. If you start to deteriorate, that's where I think there are some calls in the past. I think I've heard some a local person. I think there was a story in the news about someone who they were told to stay home and then they ended up passing away. And that's a tragedy. But I think it was a few days earlier they told them to stay home. Well, if they continue to deteriorate and go downhill, then you are going to need to change things. If you're not getting better, then you need to check in again and make sure that you're okay. And then, so the last thing we want is to tell someone to not go to the hospital and then have them continue to get worse and get to the point where they can't get better again. That's something we're all very much afraid of. But we're trying to make the best decisions because the hospitals are getting very full. And they're opening up more and more units, like I think not Cobo Hall, TCF Center. It was the old Cobo Hall down. I think that has 900 beds. It's open now. They're talking about opening the Expo Center, the Suburban Showcase in Novi.
You're right.
That's going to become the next place. And obviously, I think everyone's heard that Beaumont Wayne, which was Annapolis Hospital, that's been set up as a COVID unit where they've turned a lot of their ORs and other rooms into COVID spaces.
Chief, I've been listening to the news and a lot of reports where Henry Ford Hospital has 600 to 700 workers infected, testing positive for COVID within the medical industry. And I know, you have your hand and your pulse on this. What are your thoughts and what are you looking at here? What does the future look like for those first responders?
Right. That's
for our healthcare.
And that has everyone's quite alarmed about that. Like we wish. I don't know what level of PPE, and now when you're in that environment for 8 hours, 12 hours, and you're just surrounded by this, there's gonna be cases where unfortunately healthcare workers are gonna get sick. If you had ideal PPE where you're completely encased in like a Tyvek suit with either a full face shield a full face shield and respirators and maybe double gloves, like anything you could do to as a barrier between you and this disease is gonna be helpful. And I don't know what the details were for any of the people that have been getting sick. I know that everyone's doing what they can. But the CDC just changed as far as wearing a mask. Like now they want everyone wearing a mask. Now our firefighters are wearing masks. Yeah, inside the station now they're wearing a mask, which is something else that's kind of unusual, except for in certain areas where they don't have to wear it. But for the most part, in the common spaces, they have a mask on. So for our guys, what we're doing now, and this is we just put the fourth squad in service. We always have 3 squads in service. We've been watching the numbers, and now with the level of decon that we have to do after every call, we're having more manpower respond to every call because of the PPE improvements that we've just put in place. It's a longer turnaround time for our guys to get clear to get ready for another run. So the call volume's gone up, and every call's taking a little bit longer, and so we put another squad in service. And so that squad went into service. Well, actually, it's going in tomorrow. so where it will be all the time. So there'll be 2 squads in the north end and 2 squads in the south end that are fully staffed and manned at all times. That should help. We've been keeping up with the calls. We had to call mutual aid a handful of times, which is a pretty rare event, and I think we've called 4 times recently.
So your call volumes have gone up, but not for fires, right? I mean, it's more so for health issues.
Actually, I would even say some of our other calls seem to have gone down a little bit. I think people really are reluctant to go to the hospital in general unless there's something really wrong with them. They don't want to go to the hospital, but the COVID type calls are taking place of the other calls that seem to be diminishing to some degree. And so our call volume as a whole has gone up, and we still are getting fires, and we still are getting some of those other things as well. We had a bad windstorm. I mean, it wasn't terrible, but we had some down wires. I think Sunday, maybe I think it was over. I think, yeah, maybe it was last Sunday. So somewhere around there, we had a bunch of down wires. So then we have all these, there's only so many resources, and we're trying to do the best that we can. And we've never missed any calls, and we've never had any long response times, nothing like that. We've always had units available to respond immediately to any 911 calls. And that's our number one priority. And then the safety of our firefighters. That was just what they've done now is the Tyvek suits. Ford donated a lot of face shields. I'm not sure if you saw that in the news. Yeah, we're very thankful for that. Again, the emergency manager, Lee Gavin, has done tremendous amount of work in getting us supplies. And our EMS coordinator, Lisa Martin. A lot of people know Lisa Martin from writing all the grants, but she's also an excellent EMS coordinator on top of the rest of this. And so she's on the HEMS board. I attend a lot of the HEMS meetings. And she's been very instrumental in all of the changes that have been made and the way that they're put out to our guys. We know instantly as soon as there's a change, and she's been great at finding us all the PPE as well, along with emergency manager Gavin. But we're doing pretty well right now with the N95 masks. I think a lot of people are familiar with those. So the N95 mask, Ford got us all the face shields, and now we have Tyvek suits that we're going to be wearing on almost every run. COVID type run. And I mentioned Ford. There's a lot of places. Rusted Crow actually made their own hand sanitizer, so they brought us a lot of that too, and that's been great. So there's been a lot of working together with the community, and so these things are terrible, but it's also you see kind of the best in people as we kind of pull together and help one another out in times like this.
Absolutely. And I think people are really stepping up to the plate. A lot of individuals are making sure that, our frontliners are well fed as well, in the hospitals, the contributions that Ford made. And really, I think taking those measures in terms of making sure that our frontliners are protected, and the lack of the PPEs is just astronomical, and I think once we can get that into place and make sure that is utilized, we won't be looking at 600 to 700 healthcare professionals being infected. I think that is the most dangerous thing that I've heard as of yet. So hopefully we can rectify that and protect them. I'm not quite sure how that's going to move forward, but I know Ford Motor Company and others have really stepped up to do that. And I really believe, my belief is wearing a face mask, everybody wearing a face mask can help and can deter this from spreading. Is that something that you're advocating for as well?
Yes, absolutely. You want to always have you always want to have the social distancing is huge. It's very important, but to have a mask on, and that's kind of to keep your germs to yourself. That's kind of a good way to think of it. And well, that's one of the things you might, if you call 911, the first thing we do now is we give you a mask and we ask you to put the mask on, because that helps protect us as well. When our dispatch has done a great job too of screening these calls, and we're asking the patients, if at all possible, to step outside when the ambulance gets there. So then if they're standing outside and we can give them a mask and they put a mask on, and then we can get them in the squad, it really cuts down on the exposure time that our firefighters are facing. Because when you're in the back of an ambulance, you're in a real tight enclosed space. And so there's the likelihood of being exposed to a virus is much greater than if you're in a hospital setting. But or in an open space. So Yeah, that's wearing a mask is very important, and so to the point now where all the firefighters are wearing a mask while they're on duty at the station. So, and I would strongly recommend that if you're out in public to wear a mask. I wear one. Everyone in my family wears one. If you're going out and like if you need to pick up things at the grocery store, for example, wear a mask, and even gloves are a good idea.
Sure. And just sheltering in place. I mean, we've been sheltering in place for the last 3 weeks, and I have elderly parents. So the only thing I do is get in my car, drop them off food to their front door at times, and come back. And that has been, that has been sort of the pattern. And I think that's really important for people to realize that that is one of our weapons against this virus, is sheltering in place, social distancing, wearing the masks, and just following instructions until this is eradicated. Chief, what message do you have to the residents? What is on your wish list in regards to being able to work together, to be able to have that cohesiveness with the residents doing what they have to do to help you do your job better, and vice versa?
Yeah, well, almost everything you just said. Stay home. Listen to the CDC. Listen to what the governor has to say. Please stay home. If you stay home and if if you have to go out, that's when you be sure you employ the social distancing, wear a mask, and do everything you can to prevent yourself from getting sick. Because like if one, obviously you just get one person sick, how much it spreads. I think we've all seen the different graphs and everything from CDC, the way something like this can really take off. And so stay home. If you don't need to go anywhere, don't go anywhere. Follow our example, like we could be sitting in a studio right now, but we're not doing that. We're doing this by Zoom, and that's the responsible thing to do. If you don't need to go into work, don't go into work. Do things remotely. I mean, it's so much safer, and that's how this is going to ultimately we can put give this virus no place to go, and we'll be able to really get the upper hand on it as things start to turn. But Michigan was 3rd in the country, I believe, the last time I heard.
Yes.
And Wayne County at one point was 7th in the country. So we're right in the middle of it. And these things it's very real. There's still people that are questioning how serious this is. It is as serious as it gets. I mean, it could be, it could really get out of hand if luckily we're following all the things now. It would have been nice if we started a little bit sooner, but as we're learning as we go. This is our first global pandemic for everyone here, unless you're alive for the Spanish flu in 1918.
1918.
Right. Yeah. So
well,
yeah, and take care of one another. And if you have elderly people that it's a good idea to call and check on them, make sure they are getting the things they need. Like you said, you're dropping things off for your parents. We're doing the same thing for our my parents and my mother-in-law too. So those are the kind of things that we need to do to watch out for each other, and we will get through this. It's going to take some time, but it's hard to see, the other side, but we are going to all get through it. We just have to stick together and keep following the rules, listen to the CDC. Those are the experts, the World Health Organization. That's where we're going to get the best knowledge and the best course of action, and just be patient with one another, and we'll get through.
We will get through this. Chief Dave Brogan, thank you so much for taking the time to be with us. God bless you. Stay safe out there. Everyone, we need to do our part. We need to make sure that we also take measures to keep each other safe and keep the individuals who are taking care of us safe as well. Wear those masks, social distancing, wash those hands. Even when you get boxes or deliveries, make sure you wear gloves, or make sure you wipe them down before bringing them in. Or I've been just leaving them in the garage until the next day, at least 24 hours until I'm even touching them, and then wiping them down. So all those little things will keep us protected, keep your families protected, and also keep those valuable, wonderful human beings and individuals out there on the front lines protecting us protected. Thank you so much for joining us on WDHT TV, and please be safe out there. Thank you, Chief, again for joining us. Safe to you and your family. God bless.